As COVID-19 cases rise, it falls on hospitals to find the resources to treat those patients. I went to Sarah Bush Lincoln Health Center today to find out what its staff is doing as beds fill up.
During the first wave, if you want to call it that, we didn't see a lot of activity here.
That's not the case anymore for Sarah Bush Lincoln Health Center. Vice President of Medical Affairs James Hildebrandt says what used to be 10 to 20 COVID-19 patients at a time for the health center is now much higher.
Now we're currently consistently running in the low 40s, 44, 42, 43, and it's been that way for well over a week now. The numbers seem to be continuing to drift upwards.
Hildebrandt says the health center uses special negative pressure rooms for COVID-19 patients, and those need to be retrofitted. He says 31 rooms are in line to be updated to control airflow and contain the virus.
We don't really know, how much is going to be enough.
Those rooms are set to be operational within the next couple of weeks, but space is filling up all across the building. Hildebrandt says because of this, inpatient elective surgeries are being delayed, even if it can be jarring for patients.
With the fact that our hospital is completely full, what we don't want to do is do surgery on those patients, have no place to put them because we've got a whole bunch of COVID patients that need beds, and then they don't get the care that they need so that they have a good outcome from their surgery.
To help reduce numbers, Sarah Bush Lincoln unveiled a new COVID at Home program yesterday. It provides patients that are released from the hospital medical equipment like a thermometer and oxygen reader, televisits from providers, and a hotline for any other medication necessary.
I think it's a safety net for the patient. It also, I think, instills a sense of confidence in the patient that they're not going to slip between the cracks and have something bad happen to them at home. And ultimately, hopefully, it will free up some beds that we can use for the people who are not good candidates for being treated at home.
Hildebrandt says he expects numbers to rise as the holiday season approaches. He advises those who will be with family indoors to use large ventilated rooms, open windows, and always wear masks.